Hello, I'm Dr. Aditya Banta. I'm an orthopedic spine surgeon. Today, I'm going to share a story of my patient who had developed paralysis, but now, after 8 months of surgery, is walking absolutely normally.
मेरा नाम दिनेश कुमार सिंह है। मैं हिमाचल का रहने वाला हूँ। मेरी उम्र 38 साल है। मुझे दिसंबर 2018 से पीठ में दर्द उठा।
So the patient initially presented to us with back pain for the last 1.5 months. Patient was bedbound for the last 2 days. Patient was investigated in form of MRI. This is a sagittal MRI in which we can see there were a total of 4 vertebrae of the patient which were affected in the disease process. There was severe compression of the spinal cord as can be seen in the image on the top. There was more than 50% destruction of the bone of the patient's vertebra as can be seen in the image below. The patient was advised surgery in view of these findings. However, the patient refused and hence was put on antitubercular drugs and strict bed rest. Patient had some relief of pain and at 1 month follow-up was doing good, but owing to his overconfident, the patient started walking and this led to a fall and a weakness in his both legs, leading to complete loss of power.
जनवरी के महीने में चलना फिरना मेरा बंद हो गया। पाँव में कमजोरी आ गई। मैं गिर भी गया था।
The patient required this extensive surgery spanning over more than 8 spinal vertebral levels. There was pedicular decompression which was done for this patient so as to preserve as much bone as possible for further future results. This is the neurological improvement which was seen on the first post-operative day. There was some regaining of power in the left lower limb with a little bit lesser improvement in the right. The patient at his home. It has been 15 days since surgery. Now the patient is able to lift his legs against gravity. What needs to be seen right now is that the patient is able to stand with help of his relatives at 1 month follow-up. The patient had financial issues, hence we had to be innovative and try to do things with locally available material like this construction drum which was used to help the patient practice his standing. Parallel bar for his physiotherapy at his home using sanitary pipes. The total cost of this project was about 2000 rupees. At 4 months follow-up, the patient is able to walk independently on these parallel bars. Finally, at 6 months follow-up, the patient is walking totally independently. The patient does not require support of any walker or any stick, and the patient is really doing well. Additionally, we can see the range of motion of his spine, despite fusing those 10 levels, is extremely good, and he is able to touch his feet even after this long surgery. Also, he is able to sit cross-legged on the floor. So to conclude, the myth that spine surgery causes paralysis is completely wrong. Instead, a surgery that is done at the right time and the right place can in fact help a paraplegic patient to walk. Thank you.